When we talk about bariatric surgery or weight loss surgery, there are some nutrition considerations that I want you to be familiar with. Some of the nutrition considerations are going to depend on the type of surgery. The criteria listed here are some of those criteria that are also in your learning unit, but look at patients who may be appropriate for surgery. So there are BMI standards for surgery with a BMI above 40, or if someone has a BMI above 35 and has severe obesity-related comorbidities, in other words, other health conditions that are related to their obesity that are thought to perhaps improve with significant weight loss. They need to be an acceptable operative risk, meaning that the potential benefits of the weight loss surgery outweigh the risks, or the likely risks, I guess we would say. Typically, we want to see that people have documented failure on non-surgical weight loss approaches. So essentially what that means is that people have tried more conservative measures before they go to surgery, since surgery is obviously a more high-risk procedure. Want people who are psychologically stable with realistic expectations, as that really impacts how successful they are following surgery. Patients need to be well informed and motivated to make the changes they need to make, as well as follow through with the medical care that needs to happen following surgery. It's important that patients have some sort of support system, whether that's family, spouse, or other social environments that they're in. They really need to have that support. It's important that patients do not have a psychotic or depressive disorder that's uncontrolled. Certainly there may be patients who have a history of that, but it's well controlled, that could be appropriate for surgery. And then finally, not having active alcohol or substance abuse. So there's a number of bariatric surgical strategies. There's specific surgeries that have these approaches, but basically this is sort of the general categories. There are malabsorptive procedures, which are procedures which decrease the absorption of calories, which make someone not utilize those calories and hence not store them as fat. Along with those, that means they do also tend to malabsorb other nutrients like vitamins and minerals. So that's a consideration when we look at nutrition following surgery. Then there's restrictive procedures that restrict off a portion of the stomach and or small intestines where food goes to. And so those really work by helping the patient feel full very quickly on a small amount of food. Often both of these are combined in an individual procedure. Again, there are some more details in the learning unit. Here are some of the common procedures used. The Roux-en-Y gastric bypass is a very common procedure. Laparoscopic adjustable gastric banding, or the lap band, is another option. Sleeve gastrectomy. Biliopancreatic diversion is an older type of surgery that is most rarely done and only in situations with typically with extreme obesity, because the risk of malnutrition with this type of surgery is very high. So you can watch through the videos in the learning unit that give a little bit more description of how those work, and I want you to think about whether those are restrictive surgeries or malabsorptive surgeries or a combination of both. When we look at expected weight loss, this is generally expressed as a percent of excess weight loss. And what that means is if we look at what would be considered the quote-unquote excess weight, that would be the amount of weight above someone's ideal body weight if we looked at like a standard chart. So if someone, for example, had 100 pounds of excess weight, so say their ideal body weight is 150 pounds and they weigh 250 pounds, we would call that 100 pounds excess weight. So the expected weight loss for different procedures are based on that excess weight. So you can see it varies between surgeries, with the gastric banding being just under 50%, so about 47% excess weight loss expected. The Roux-en-Y gastric bypass about 62%, and the biliopancreatic diversion about 70%, with an overall average in the ballpark of about 61% of excess weight loss. When we look at this weight loss, then you kind of look, so again, using the example, if someone has 100 pounds of excess weight with gastric banding, we would expect they would lose about 47 pounds of that. With Roux-en-Y gastric bypass, about 62 pounds, etc. So a couple things to take from that. One is that you realize people aren't necessarily going to get back down to what would be considered an ideal body weight. They will be much closer and they will have significant health benefits most likely from that. However, it's not going to put them necessarily in an ideal body weight range. So it's important that people realize that before they go through with the surgery. The other piece to look at here is when we say, okay, biliopancreatic diversion has the most weight loss, why wouldn't we want to just do that? Typically, the surgeries that have more weight loss expected also have more risk of malnutrition because essentially less nutrients are getting absorbed. There's more of the gastrointestinal tract that's bypassed, and so it increases that risk for malnutrition. So that's where it's important for an individual patient to work with their surgeon, obviously, to decide what's the most appropriate that gives them the most benefit with the least risk for them. And that's going to depend on the patient's situation. So following surgery, these are some general guidelines following bariatric surgery. It's going to be somewhat individualized based on the type of surgery, but for the purposes of this class, just knowing these general categories is sufficient. So in general, patients are going to want to follow a low-fat diet. Typically, the fat is not well absorbed, and so if patients are following a higher fat diet or having high-fat foods, they will often have gastrointestinal upset from that. It's not going to sit well. So typically low fat. The same with low sugar. The sugar will move very quickly through that digestive tract and often will cause diarrhea or what's called dumping syndrome and those types of symptoms. So in the dumping syndrome, people can get very flushed, hot really quickly after eating and then have diarrhea as well. So that low sugar intake. With the lower fat, lower sugar, that also is going to reduce some of the calories that they're eating, which is beneficial. Often patients don't absorb lactose well following surgery, and that has to do with, particularly, for example, Roux-en-Y gastric bypass surgery, has to do with the portion of the small intestine that's bypassed, and that's where lactose is digested. And so when that portion is bypassed, it's not digested well, and so the lactose isn't broken down and ends up lower in the GI tract where it really isn't normally found, which can cause cramping and diarrhea. So patients typically need to follow a low lactose diet. Small portions, the patient's stomach is going to be much smaller than it was, and for many surgeries it's going to be a much smaller opening from the stomach into the small intestine. So it's important patients eat small amounts, and they're going to need to eat more frequently because the amount they can eat at one time is so small. They need that more frequent eating in order to get the nutrition in that they need. Generally, it's recommended to separate food and liquid. One reason for this is because if a patient drinks liquid, it's going to fill them up quickly. And so then often they don't have room for the food. Sometimes they actually will vomit if they eat it together, particularly early after surgery. The other thing is that sometimes that liquid can really liquefy the food and make it move too quickly through the stomach into the intestines. And one way many of the surgeries work is that small opening from the stomach into the small intestine limits how quickly food can go through, so it helps a person stay full longer. If we liquefy that food, that takes away that benefit of the surgery. That's the same rationale for the next bullet item, which is to limit or omit liquid calories. So when we eat solid foods, it's going to fill that smaller stomach quickly, causing us to eat less. But if we drink a lot of liquid calories, for example, juice and milkshakes and things like that, even smoothies, they may be healthy, but that liquidy consistency is going to move very quickly through the stomach and isn't going to allow really the tool of the surgery to work as well as it could. And then carbonated beverages typically aren't well tolerated because of the bubblies in there, in that very small stomach pouch. It typically will cause people discomfort. So those are basic long-term recommendations following surgery. Very initially after surgery, patients will follow a very sequenced diet, I guess, starting with liquids, very easy to digest things, and then gradually move to more solid foods. But these recommendations are sort of the long-term maintenance diet recommendations for most patients. There are several nutrients that are most at risk of deficiency. Now, again, because food is not going to be digested and absorbed as well as it was prior to surgery. Other things can be deficient as well, but these are some of the most common that typically need to be supplemented and really need to be monitored in patients following surgery. So vitamin B12, because of how vitamin B12 is broken down and absorbed between the stomach and small intestine, it doesn't do that as well when part of the intestine is not in the loop, so to speak, anymore. So important to supplement B12, and often a different type of supplement, sometimes even an injection is recommended of B12 to bypass the gastrointestinal tract entirely. Vitamin D is also important and often needs to be supplemented, as well as calcium. Again, a lot of these have to do with where they are normally digested and absorbed, particularly absorbed in that upper part of the small intestine, which is bypassed following the surgery. Iron and protein are also important. For protein, often people will need to do some sort of a protein supplement, protein shake, that type of thing, early after surgery. That's not necessarily necessary forever, but when the person is not really able to eat a lot of high protein solid foods initially, typically those aren't well tolerated, they often will need to do some sort of a supplemental protein drink in order to get adequate protein for healing. So following bariatric surgery, really important that patients understand the diet that they would need to follow and that they're okay with that, and that they take their supplements regularly and are monitored by their physician following surgery to ensure that they don't end up malnourished in the area of these different vitamins and minerals. So we really want to make sure that following surgery, patients are following the nutrition recommendations, both for food and supplements, and following up regularly with their physician and their healthcare team regarding their nutrition status.